As allied health professionals, we're proud to be members of a diverse and dedicated group of people in one of the largest clinical workforces in the NHS. Today, allied health professionals touch on the lives of the majority of people, carers and communities accessing services, improving the lives of citizens across the UK. But tomorrow, AHPs could have an even larger role to play, leading sustainable change across the whole health and care system and beyond. By being equipped with the right skills, we can all be empowered, ready to make the most of the universe of opportunities open to us, so our AHP careers can take off and reach for the stars. There's never been a better time to further develop your career as a qualified allied health professional, whether you're mid-career, returning to work, or simply looking for the next steps. A recent crowdsourcing consultation, AHPs into Action, asked thousands of people, including patients, carers, the public and staff, about the contributions that AHPs make, and concluded that AHPs are uniquely placed to help the NHS and local authorities meet their strategic goals. This has led to an increased profile for AHPs, with many new roles, services and leadership opportunities being created, and a recognition of the need for further career support and guidance for new joiners and those already started on their AHP journey. Much of this is driven by the changing career expectations of our diverse workforce. Today we expect flexibility in our careers and may not want a simple linear career path from A to B or C, but instead a portfolio career where we're free to mix and match our skills and experiences, to try out new roles and new ways of working, to grow and develop at every level. In short, to build a career that's right for you. Several AHP professional bodies have produced career frameworks that map out these opportunities. One useful feature of many of these is the 4 pillars of clinical, education, research and leadership and management opportunities. The clinical pillar supports you at every level of your career now and into the future. Not only will you be making a real difference to people's lives, driving improvements in care, but also developing, supporting and inspiring other clinicians into their chosen roles. There are many roles in health research, everything from encouraging patients to get involved in studies, right through to leading your own health research as an investigator. After all, clinical research is for all of our futures. The leadership pillar empowers you to explore and develop your clinical leadership skills. Here you can use your AHP skills and experience to improve services and care to our population. And the education pillar helps you to develop your teaching interests by becoming a practice-based educator, contributing to the design and delivery of teaching and learning in a university or clinical setting, collaborating to publish a paper, and developing your own academic skills through postgraduate study. Best of all, you can pursue any of these interests while still keeping your day-to-day clinical role. And the opportunities open to you don't stop there. Public health is part of all AHP roles already. There are opportunities to progress your career in this field by becoming a local public health champion, or developing your skills to become a consultant or director of public health. You could pursue a fellowship, a sponsored secondment in this country or a developing country with lots of support. You could get involved in digital initiatives, including opportunities for working within clinical informatics and digital transformation, using digital tools and cutting-edge technologies to support the development towards digital health and care services at a local level. Or you could follow an entrepreneurial route, setting up a not-for-profit organisation, a private practice, taking part in a national scheme, or creating your own digital service or app. All of this could see you working outside your organisation and the wider health and care system, with further opportunities across government, academia, the voluntary sector. The list goes on. AHP's unique skills, experience and ability to engage across the system and innovate in their work puts them in an ideal position to help solve the growing issues facing the NHS. So how can you align your career aspirations with the needs and opportunities of today's health and care system and beyond? First of all, take a look at the career frameworks that have been produced. Listen to some of the AHP voices we've gathered from across the NHS in our online resource. Speak to people in interesting roles inside and outside your organisation to understand the potential opportunities. Identify someone who could be a coach or mentor to help you reflect and identify your career aspirations. Use the AHP Online Careers resource to help shape and direct your personal development plans. Above all, think about the skills you'll need to prepare yourself so you're ready to creatively embrace the possibilities and explore this new universe of opportunities.